So I'm Professor Simon Lewis. I'm at the Brain and Mind Centre, University of Sydney, and I mainly focus in Parkinson's disease and other dementias. So currently, our treatments for Parkinson's are symptom relief. Basically, everything we do with Parkinson's patients is to try and limit or alleviate the symptoms they have, and they're effective for a certain period of time. But as the disease progresses and more cells are dying in the brain, really the inevitability is that people get worse, either physically or non-physically, dementia, psychosis, all of these things that we see. So what we're really looking for is something that will stop or slow those cells from dying, and that's where our novel approaches really need to be focused.
My name's Clyde Campbell, CEO for Shake It Up Foundation. We started the foundation back in 2009 after I was diagnosed with Parkinson's at the age of 44. My day job is in all to do with robotics and industrial automation. When we first started the foundation, we wanted to ensure we were globally competitive. So we formed a partnership and a collaboration with the Michael J. Fox Foundation. This ensures we're globally competitive in the research we fund right here in Australia, but also doubles our dollar in research that we fund here. So if we're a $100,000 project, we'll fund $50,000 and Fox will fund $50,000, making us our opportunity to be able to get more research done right here in Australia.
In the Medical Journal of Australia, just coming out in honour of Parkinson's Awareness Week, is a perspective article that I've written, really targeting where we are with trying to find a cure for Parkinson's disease. And what it does is it says, well, how do we start to find a cure when we don't actually know the cause? Similarly, we're seeing things now where we can look at the epidemiology of people taking drugs. So for example, people who've taken an inhaler for, say, their asthma versus a beta blocker for their blood pressure. Now, the clinicians will know that those drugs essentially work on the same receptor in different ways, on that beta adrenergic receptor. And interestingly, the people on the inhalers have a lower risk of getting Parkinson's, the people on the beta blockers have a higher risk, and that begs the question, well, why should that be? And the answer has to come down to the molecular biology. So we're getting clues, if you like, from the basic science. And that then allows us to say, well, can we target therapies? And the other, if you like, streamlined approach is to say, well, hang on, if we know something about drugs and we just talked about beta blockers and whether beta agonists might be better, maybe we should trial drugs that we already have in humans to see whether they might benefit through if you like, actions that the drug may have that we didn't really know about. So for example, one of the trials that's running here in Australia right now looks at the data and says, well, we have drugs that remove iron from the blood of patients with thalassemia.
The support from family and community means so much to everyone with Parkinson's. It's a challenging disease, especially when it's so less understood out there in the public domain. If we can get it out there and to be known what the symptoms of Parkinson's are and the true challenges of living with the disease, it'll make a big difference for those people with Parkinson's. One of our key events is going to be the O Media campaign. It's running right now, and you'll see it on a lot of outdoor advertising in shopping centres and also at airports, where electronic media is showing the symptoms of Parkinson's and how we're working with those to be able to alleviate it. On World Parkinson's Days, the 11th of April, we're holding our launch at O Media with Brendan Cook, their CEO, and we'd hope to be able to launch with a bang there to ensure everyone understands more about Parkinson's in their life. Most definitely, as positive about finding a cure for Parkinson's, and even more so about finding ways to slow and stop the disease in the near term.